In this video, you will learn everything you need to know about prostate cancer, including screening, diagnosis, treatment options, and long-term survival outcomes. By the end of this video, you will have a comprehensive view about the disease and what are the best steps that you could take to prevent it. We will clarify common myths about the disease. We'll advise you on how to detect it early and choose the best treatment option if you were unlucky to be diagnosed with it. Every day, millions of men scroll through their social media feeds and encounter something that could change their lives or end them. Videos promising miracle cures for prostate cancer. Supplements guaranteed to reverse the disease with no side effects. Testimonials from people claiming they beat cancer with special teas or exotic herbs. These videos accumulate millions of views. The comment sections overflow with desperate questions from frightened men and worried family members. Behind each click lies enormous profit from fear and false hope. But what if we told you that after decades of rigorous research, involving hundreds of thousands of patients across the globe, the real answers about prostate cancer prevention, detection, and treatment are both simpler and more complex than any miracle cure claims? This is the story of the second most common cancer in men worldwide, a disease that will affect 1 in 8 American men during their lifetime. A condition where the difference between life and death often comes down to information, real, evidence-based information that cuts through the noise of online misinformation. It's also the story of hope, because unlike many cancers, prostate cancer is largely preventable. When detected early, it's highly treatable. And the steps to protect yourself are within every man's control, if you know what they are.
Are supplements safe to take, and do they prevent against prostate cancer?
To understand why so many men fall victim to prostate cancer scams, we must first understand a troubling truth about the supplement industry. Unlike prescription medications, which undergo years of rigorous testing and FDA approval, supplements can be marketed with virtually no oversight. When a pharmaceutical company wants to market a new drug, they must conduct extensive clinical trials, provide detailed safety data, and prove their medication actually works. This process can take 10 to 15 years and cost hundreds of millions of dollars. Supplements face no such requirements. A company can create a new supplement, make bold health claims, and begin selling it with no proof it works, no proof it's safe, and no guarantee that what's on the label is actually in the bottle. Independent testing has repeatedly revealed that many supplements don't contain the amounts of ingredients listed on their labels. Some contain harmful contaminants. Others contain prescription drugs not disclosed on the packaging. One particularly disturbing case, published in a leading medical journal, involved men taking natural men's health supplements that secretly contained testosterone and other hormones. Several developed rapidly spreading, aggressive prostate cancer. While some products were eventually pulled from the market, similar supplements continue to proliferate online. The pattern is always the same. Videos with testimonials, but no scientific evidence. Claims of miracle cures with no side effects. Pressure to buy immediately before you have time to research or consult your doctor. And always the promise of a simple solution to a complex problem. Every intervention powerful enough to have beneficial effects also has potential for harm. Even water can be dangerous if consumed in excess. When someone claims their product has absolutely no risk of side effects, they're either lying or their product doesn't actually do anything.
Where is the prostate, and how does prostate cancer develop?
To understand prostate cancer, we must first understand the prostate itself. This walnut-sized gland sits below the bladder, surrounding the urethra, the tube that carries urine and semen out of the body. The prostate produces fluid that nourishes and protects sperm, making it essential for male fertility. The prostate's location creates unique challenges. It's surrounded by structures that control some of the most fundamental aspects of male function. The nerves controlling erections, the muscles controlling urination, the rectum, and the bladder. Any problem with the prostate, whether cancer, infection, or simple enlargement, can affect sexual function, urinary control, and bowel health. Prostate cancer occurs when cells in the prostate gland begin growing uncontrollably. But unlike many cancers, prostate cancer exists on a vast spectrum. On one end are slow-growing cancers so indolent they may never cause problems during a man's lifetime. On the other are aggressive cancers that can spread rapidly and become life-threatening within months. Globally, prostate cancer is remarkably common, but its distribution tells a fascinating story. North America, Northern Europe, and Australia have some of the highest rates worldwide. Many Asian countries traditionally show much lower incidence. But when men migrate from low-risk countries to high-risk ones, their cancer rates gradually increase over generations. Japanese men who move to America don't immediately develop American cancer rates, but their sons and grandsons do. This reveals a crucial truth. Lifestyle and environment, not just genetics, drive prostate cancer risk. What's particularly concerning is that prostate cancer rates are increasing worldwide. Recent cancer statistics project more new cases this year than last, continuing an upward trend that appears linked to the global adoption of Western dietary patterns and sedentary lifestyles.
Are there any preventative measures against prostate cancer?
Some of the most groundbreaking prostate cancer research has emerged from Harvard University's School of Public Health, where scientists have followed more than 50,000 men for decades, meticulously tracking their diets, lifestyle habits, and health outcomes. Their findings revolutionized our understanding of prostate cancer prevention. Men consuming the most plant-based foods showed a 19% lower risk of dying from prostate cancer compared to those eating the most animal products. But the research revealed something even more important. Both reducing animal foods and increasing plant foods appeared independently protective. These findings align with classifications from the World Health Organization. Processed meats, bacon, hot dogs, soyages, deli meats are classified as Group 1 carcinogens, the same category as tobacco smoking and asbestos exposure. Group 1 means there is sufficient evidence these substances cause cancer in humans. Red meats like beef, pork, and lamb are classified as Group 2A carcinogens, probably cancer-causing in humans. This places them in the same risk category as DDT and mustard gas. In contrast, plant foods contain thousands of compounds that actively fight cancer. Cooked tomatoes provide lycopene, a powerful antioxidant that's more easily absorbed when heated. Cruciferous vegetables like broccoli and kale contain glucosinolates that break down into cancer-fighting compounds. Soy products, despite persistent myths, consistently show protective effects in population studies. These plant compounds work through multiple mechanisms, neutralizing harmful free radicals, supporting the body's natural detoxification systems, providing fiber that may bind cancer-causing substances, and delivering nutrients that support immune function. Physical activity provides another powerful tool for cancer prevention. Current guidelines recommend at least 150 minutes of moderate-intensity aerobic activity weekly. Think brisk walking where you can talk but not sing, or 75 minutes of vigorous activity where conversation becomes difficult. But here's encouraging news. Recent research showed that literally any increase in physical activity provides benefit. The guidelines removed minimum daily requirements because even small amounts of movement are better than none. Park farther from store entrances. Take stairs instead of elevators. Walk during phone calls. Every step counts.
Does prostate cancer run in certain families?
While lifestyle accounts for roughly half of prostate cancer risk, genetics determine the other half. Understanding your genetic risk can be life-saving, but many men don't realize they need to look beyond just prostate cancer in their family history. The same genes that cause breast and ovarian cancer in women also increase risk for aggressive prostate cancer in men. The BRCA genes, famous for their connection to breast cancer, create similar vulnerabilities in men. A man whose mother or sister carries a BRCA mutation faces not just higher prostate cancer risk, but typically more aggressive disease when it occurs. Other cancers cluster in families with hereditary cancer syndromes. Pancreatic cancer, certain colon cancers, and other malignancies can all signal genetic predispositions that affect prostate cancer risk. The age at diagnosis matters too. Cancers occurring at younger ages more likely involve genetic factors. For men with concerning family histories, genetic counseling and testing can provide valuable information for screening decisions, treatment choices if cancer develops, and guidance for family members. But genetic testing isn't appropriate for everyone and requires careful consideration of psychological, social, and potential financial implications.
Does ejaculating more frequently help reduce the risk of prostate cancer?
One of Harvard's most attention-grabbing studies examined a rather personal aspect of men's health: ejaculation frequency. Using their decades-long database of male health professionals, researchers asked men to recall their ejaculation patterns during different periods of their lives. The results surprised many. Men reporting 21 or more ejaculations per month showed approximately 20% lower prostate cancer risk compared to those reporting 4 to 7 monthly ejaculations. This statistically significant finding sparked both scientific interest and popular fascination. The leading theory involves what researchers call the stagnation hypothesis. The prostate continuously produces fluid containing various substances. Regular ejaculation ensures this fluid is expelled and replaced, potentially preventing buildup of harmful compounds that might contribute to cancer development. The study didn't specify how ejaculation was achieved, and from a biological standpoint, the protective mechanism should theoretically work regardless of method. However, safe practices remain essential. Sexually transmitted infections might actually increase prostate cancer risk through inflammatory pathways. While this research provides interesting insights, it represents just one piece of the prevention puzzle. Sexual health is individual and personal. The number 21 was simply the study's statistical cutoff, not a magic threshold every man must reach. Most importantly, this finding shouldn't distract from prevention strategies with much stronger evidence.
Does prostate cancer often cause any waterwork symptoms?
Scroll through health content on social media, and you'll find countless videos promising to reveal early warning signs of prostate cancer. These videos accumulate millions of views from men desperately seeking reassurance or early detection guidance. The symptoms they list sound alarming: frequent urination, especially at night, difficulty starting urination or weak stream, blood in urine, erectile dysfunction, pelvic pain. But here's the uncomfortable truth these videos won't tell you. These are generally not early signs of prostate cancer. Most urinary symptoms in men result from benign prostatic hyperplasia, simple prostate enlargement that occurs naturally with aging. By age 60, about half of all men show some prostate enlargement. By 85, this increases to 90%. As the prostate grows, it can compress the urethra, causing urinary symptoms that have nothing to do with cancer. Blood in urine more commonly indicates infections, kidney stones, or bladder problems. Erectile dysfunction usually stems from cardiovascular disease, diabetes, stress, or medications rather than prostate cancer. When prostate cancer does cause symptoms, it typically means the disease has grown large or spread beyond the prostate, making it much harder to treat successfully. This is why screening becomes so crucial. Unlike many cancers that announce themselves with symptoms, prostate cancer often grows silently for years. Screening allows detection when cancer is still confined to the prostate before symptoms develop, when cure rates are highest.
Is prostate cancer screening recommended? And what is the evidence for it?
Prostate cancer screening has undergone dramatic changes over the past decade, changes that have confused many men and their doctors. Understanding this evolution explains why guidelines have shifted and what men should do today. For years, screening involved two components: a blood test measuring prostate-specific antigen, or PSA, and a digital rectal examination where doctors physically examined the prostate. The combination, particularly the rectal exam, created significant barriers that prevented many men from getting screened. Around 2012, concerns about overdiagnosis and overtreatment led major medical organizations to recommend against routine PSA screening. Rates of screening dropped dramatically. But this also led to increases in men diagnosed with more advanced cancers, suggesting we had overcorrected. Today's approach emphasizes individualized decision-making based on risk factors and patient preferences. The rectal exam has moved to an optional, supplementary role. Screening now focuses primarily on the PSA blood test, which can be performed alongside routine blood work. PSA is produced exclusively by prostate cells, both normal and cancerous. Normally, most PSA remains within prostate ducts and is expelled during ejaculation. Only small amounts leak into the bloodstream. When something disrupts normal prostate architecture like cancer, infection, inflammation, or enlargement, more PSA escapes into circulation. Interpreting PSA requires considering multiple factors: age, rate of change over time, prostate size, family history, and other risk factors. A PSA of 3.0 might be normal for a 70-year-old, but concerning for a 45-year-old. Rapid rises over time can be more significant than absolute levels. Current recommendations suggest baseline PSA testing in the 40s for most men. This early baseline helps predict lifetime cancer risk and guide future screening intervals. Men with very low PSA levels in their 40s have extremely low risk and might need less frequent screening. Those with higher levels or additional risk factors might benefit from annual screening. Black men face higher prostate cancer risk and should discuss screening beginning at age 45. Men with family histories of prostate, breast, ovarian, or pancreatic cancers should also consider earlier screening. Those with known genetic mutations might benefit from starting at age 40.
What can cause a PSA to rise, and what should men do if they have a raised PSA?
For thousands of men each year, a routine blood test becomes the beginning of a cancer journey. Their doctor calls with news that their PSA level is elevated. Panic sets in immediately, but understanding what elevated PSA actually means can prevent unnecessary anxiety and guide appropriate next steps. An elevated PSA functions like a car's check engine light. It indicates something needs investigation, but doesn't specify what's wrong or how serious it might be. PSA can rise due to prostate enlargement, infection, inflammation, recent procedures, or even vigorous exercise. Cancer is just one possibility among many. The first step with any elevated PSA is always patience. Guidelines recommend waiting at least 4 weeks and repeating the test. If temporary inflammation caused the elevation, PSA might return to normal. Never check PSA during active urinary tract infections or while a catheter is in place. This guarantees falsely elevated results. Unfortunately, PSA testing sometimes occurs in inappropriate circumstances. Men visit emergency rooms with urinary infections and have PSA levels checked during acute illness. These invariably show elevated results, triggering cascades of anxiety and additional testing based on meaningless numbers.
What is the role of MRI in the diagnosis of prostate cancer?
The most significant advance in prostate cancer diagnosis over the past decade has been the adoption of advanced magnetic resonance imaging. MRI has transformed how we detect, diagnose, and treat prostate cancer, making the process more accurate and less invasive. Previously, men with elevated PSA levels proceeded directly to prostate biopsy, a procedure involving 12 needles systematically sampling the prostate. This approach was essentially random, like trying to find a small rotten spot in an apple by blindly inserting needles. If cancer was widespread, the needles would likely detect it. But small, localized cancers could easily be missed. Modern prostate MRI can visualize the gland's internal structure and identify suspicious areas that might harbor cancer. This capability allows doctors to better select which men actually need biopsies, and, when biopsies are performed, to target suspicious areas specifically rather than sampling randomly. When MRI shows no suspicious lesions, the chance of missing clinically significant cancer drops to about 9%. Many men can avoid biopsy entirely and be monitored over time. When MI does reveal concerning areas, biopsies can be directed precisely to those locations, dramatically improving diagnostic accuracy. This targeted approach mirrors how other cancers are diagnosed. Breast biopsies target suspicious mammography findings. Lung biopsies focus on concerning CT scan abnormalities. Prostate cancer diagnosis has finally entered the modern era of image-guided procedures.
Are all prostate cancer the same? And what are the treatment options?
A prostate cancer diagnosis triggers a cascade of emotions: fear, anger, confusion, and desperation. In this vulnerable state, men and their families become targets for those promoting unproven treatments, expensive procedures, and false hopes. But prostate cancer isn't a single disease requiring uniform treatment. Cancers are classified into risk categories based on aggressiveness, extent, and likelihood of progression. This classification determines whether treatment is necessary, and, if so, what type offers the best balance of cure and side effect risk. Low-risk prostate cancers often don't require immediate treatment. Active surveillance involves careful monitoring with regular PSA tests, periodic repeat biopsies, and sometimes repeat imaging. Many men live with low-risk prostate cancer for years or decades without needing treatment, preserving quality of life while ensuring cancer doesn't become more aggressive. When treatment becomes necessary, options include surgical removal of the prostate, various forms of radiation therapy, hormone treatments, and newer approaches like focal therapies that target specific areas while preserving surrounding tissue. The best treatment decisions emerge from multidisciplinary consultations involving urologists, radiation oncologists, medical oncologists, and other specialists. Each brings different perspectives and expertise to help patients understand their options and make informed choices.
How to identify prostate cancer scams promising false hopes?
Cancer diagnosis creates desperation that predatory marketers exploit ruthlessly. Men diagnosed with prostate cancer become targets for an entire ecosystem of scams, from expensive supplements to dangerous procedures performed in foreign countries. The warning signs are consistent: promises of cures with no side effects, criticism of conventional medicine, testimonials without scientific evidence, pressure to act immediately, and treatments available only through specific providers or locations. Some men travel thousands of miles for procedures unavailable in their home countries, often paying enormous sums for treatments that lack long-term safety and efficacy data. While some international treatments might eventually prove valuable, patients become human experiments without the protections of properly designed clinical trials. Legitimate research follows strict protocols with independent oversight, informed consent, and careful monitoring for both benefits and harms. Participants in properly conducted clinical trials often receive cutting-edge treatments while contributing to medical knowledge that benefits future patients.
What lifestyle advice is recommended after an initial diagnosis of prostate cancer?
A prostate cancer diagnosis doesn't mean life is over. In fact, many men report that their cancer experience motivated positive lifestyle changes that improved their overall health and quality of life. The same dietary patterns that help prevent prostate cancer continue providing benefits after diagnosis. Research shows men eating more plant-based diets after treatment report better erectile function,